Okay, let's see if we have any other questions. Looks like we have one from the allhealthtv.com. This is from Sammy. My sister gave birth a month ago, and when she went to feed her baby sometime after 2 a.m., she noticed he had a fever. She freaked out and rushed him to the hospital. Is that normal? Well, her response, yes, was normal. So any baby under the age of 3 months that has a fever, which is defined as a temperature of 100.4 or higher, needs to be seen by a medical professional right away. So during the day, if your doctor's office is open, absolutely bring them to the doctor right away. But if it is after hours or like your friend, 2 a.m., you definitely want to go to the emergency room. And the reason for that is that under 3 months of age, they are not fully immunized yet against some very detrimental diseases, bacterial and viruses. So, what happens is that in the first 2 months of life, they are at a very high risk of developing pneumonia, meningitis, which is a bacterial infection in the brain, and sepsis, which is a bacterial infection in the entire bloodstream. So when they have this fever, we really need to rule out that they do not have one of these three illnesses. So what happens is that the baby will have a blood test done. They will have a blood culture, which is a test in the blood to make sure that they don't have any bacteria. They'll have a urine culture, which is a urine test to make sure they're not growing any bacteria, a chest x-ray, and in some cases, depending on how sick the baby looks or is behaving, they might even get what's called a lumbar puncture, which is a what we commonly call like a spinal tap. And so those things need to be done because in the first 3 months of life, a mild infection for an adult can turn fatal in a newborn. So it is very important that they go to the hospital right away or see their medical professional. And we strongly encourage you to or discourage you from giving Tylenol or Motrin to a febrile baby. A baby under 3 months should not get Tylenol or Motrin. They should be seen by a medical professional right away. This is something where a fatal illness could be prevented within the first 24 hours of life. So Sammy, she absolutely did not overreact.